Hi, I'm Reg Blynn, Chief Sales Officer of Primary RX. I want to thank you for your time and interest in our program. What we offer physicians is a turnkey physician dispensing program with real-time adjudication. In essence, we give physicians the ability to dispense medications to their patients that they're already writing, and your patients can pay either with cash or, more importantly, using their current insurance card. This ensures that your patients pay the same exact copay in your practice as they would any pharmacy across the country. This removes any sales aspect from this program, and what it does is increase patient satisfaction and convenience. It also increases compliance in the practice and, of course, is a great revenue stream for the physician. We're able to accomplish this because of three key reasons. Number one, our software. Primary RX's software has been in pharmacies since 1993, has over 16 years of a track record, and is by far the most tried and tested software in the market. Number two, we own our own repackaging center in pharmacy. This allows you to customize your formulary to exactly your current scripting habits, and of course keeps costs down to ensure your profitability is as high as possible per dispense. And last but not least, we are truly a turnkey solution. We provide everything from the software, to the training, to the printer, to the cabinet, but most importantly, we take care of all of the credentialing for our physicians. Not only with all the major national PBMs, but any local PBMs you may need as well. Now, I understand you've heard sales pitches on all these programs before. I invite you to listen to what our clients have to say about our program, and I look forward to working with you in the near future. Thanks again for your interest in Primary RX.
My name is Sylvester Meunier. I work here at Palmetto Primary Care Physicians for the Extended Care Clinic. We've been dispensing medications using Primary RX for about 11 or 12 months now. Patients love it. We love it. It's just one more service that we can provide for the patients. For patients that even would normally go and get a free medication at Publix or a really cheap one at Walmart would still get it here just because it's now and not having to wait an hour at the pharmacy. Patients that use the military TRICARE really love it because they only spend their $3 no matter where they go. And even going on base and getting it for free, they would still rather get it here. So it's really just see your doctor, get your medication, go home, get better, instead of see your doctor, wait an hour, go to the pharmacy, wait an hour,
Bill
go home.
Stevens, a physician assistant. I've been practicing dermatology for 10 years. And in our practice here, we use Primary RX to fill many of our prescriptions. I find this to be very helpful for my patients in that not only do we supply quality brand generic pharmaceuticals at a reasonable price for our patients, but also the fact that it saves them a trip to the pharmacy. So we're saving time for our patients, and I find most of my patients find that very convenient.
Hello, my name is Jeremiah Brown. I'm administrator here at Palmetto Primary Care Physicians. We're a 19-location family medicine practice. We've been using Primary X since the beginning of 2009. Beginning of the year, we piloted in our after-hours clinic, and by the end of this year, we'll have 4 locations running the pharmacy program. We've tried other pharmacy dispensing programs a few years ago, more of a cash and carry basis, and the biggest difference between those programs and Primary RX has been our ability to bill the insurance company. It has been a huge factor in enabling us to take some of the administrative burden off the offices. And really the biggest point for us has also been the patient satisfaction factor. When patients come in, they know this is a one-stop shop for themselves. A great part of this also is being able to use the e-prescribe function through our EMR system, cut down a lot of the paperwork. It also helps us alleviate some of the phone calls and issues that we receive from pharmacies trying to figure out what kind of script we're doing because we're already dispensing within our own facility.
Steve Thomas, Medical Director for the Extended Care Clinic at Palmetto Primary Care. We have been using the program here long enough to become truly comfortable with it. It is wonderful, fantastic for the patients. They come in, they get a diagnosis, they get their medicine, they go home. Very often I see patients without insurance, and so for self-pay patients, perfect. We can save them money over their pharmacy. For the patients with insurance, we can give it to them the same price, and we can save them an hour, maybe more. As far as integrating it into the practice, not a hitch. It was a little difficult for the staff at first with the insurance processing, and just a level of comfort that came to them really fairly quickly. And so now, often, I will tell them what I'm writing, and they'll have it filled before I finish the chart and done the prescriptions. So it's a very, very fast service, wonderful for the patients, and I very, very highly recommend it.
I'm Dr. Todd Schlesinger. This is the Dermatology and Laser Center of Charleston. We've been open here for about 4 years, and we recently were introduced to the Primary RX system. We found the system very easy to use. We have a lot of patients who are really enjoying it. What we find is that the patients love to save time. They don't have to go to the pharmacy. They can pick up their prescriptions here. They can use their copay like they typically do at any pharmacy. We find it saves them a lot of time and sometimes saves them money as well. We also find it increases compliance. Patients who pick up their prescriptions right here are more than likely to get their prescription as opposed to a patient who might go to the pharmacy may not have it, they may have to wait, whatnot. So it just definitely increases patient compliance. One other thing is revenue. We definitely have found that the system has increased our practice revenue beginning for the first few weeks. We could already tell we were starting to make a little bit of extra profit with the system. So if we can do that and also help our patients save time, money, and increase compliance, we'll be very happy, and we've certainly appreciated it so far.
My name is Crystal Wells, and I work at Health First Rapid Care, one of our urgent care centers here in Charleston, South Carolina. On many days, we will see between 200 and 250 patients a day. We've had this system in place for right at 3 years. We started out with a cash and carry system, which was able to bring in some revenue, but when we switched over and were able to adjudicate the insurance claims, that's when we really started seeing a higher volume of scripts and a lot more profit coming into the practice. If I see a brand new patient that I have never seen before, I can have their insurance information, demographics, the prescription filled, them in and out the door within about 4 minutes. So it is extremely quick and very simple.
Hello, I'm Mike Gerasati. I've been in healthcare for well over 25 years and work for probably the largest healthcare solutions company in the country. My whole life has been really to look for healthcare products that either make physicians more efficient or look for a way to increase their revenue stream. I have found Primary RX to be a game changer in this space. It's the one product that we can bring to physician offices and have the conversation. Is it good for your patients, doctor? Is it good for you, doctor? Will it make you more competitive in your environment? Will it make you more efficient? And of course, will it make you more dollars in these economic times? And the resounding answer has been yes.